the secondary oocyte that was formed just prior to ovulation. So that is the A component that is going to enter into our oviduct. And if you recall, the secondary oocyte, I don't have room to write all the names in here, so let's go ahead and put it over here. So we have secondary oocyte. Sorry if I put 2 letters in on that board. And our first polar body. All right, so secondary oocyte is our first polar body. And what would be the chromosomal pattern? You guys are getting used to that term. What would be the chromosomal pattern in each of those cells? Are they haploid or diploid cells?
Haploid.
Haploid. Chromosomal pattern is in, but they have sister chromatids of each end, right? This is our first meiotic division, creating the secondary oocyte from the primary oocyte. So they are haploid cells, but their chromosomal pattern, each one is going to be 2 parentheses in. That doesn't make sense. I tried to do it with the colored pens after lecture this morning. Remind me on Tuesday, and I can work with you more individually with those colored pencils, pretending those are the chromosomes and sister chromatids, and it works a little bit better. Now, this still has, as it's ovulated, still has the zona pellucida around it. So that's why the first polar body is going to hang around with the secondary oocyte. So that's the zona pellucida. And attached to the zona pellucida, we would have the corona radiata. And additional follicular or granulosa cells. Here's a question for you. What would be the chromosomal pattern of one of these granulosa or follicular cells?
2N.
2N. I can't trick you guys. Good. Just regular somatic 2N cells, just like any other somatic cell. So remember again, on the lecture exam next week, you will have a table that will list, 4, 5, 6, 8, 10, 20 cells. Well, not high as 20. First polar body, spermatogonium, maybe a granulosa cell, a nerve cell, an oocyte, and ask you to identify the chromosomal patterns. I'll list those choices for you in 2 parentheses 2N, 2 parentheses N, 2N, and so on. But it's only our cells that are going through or have completed meiosis that we see anything but 2N. Okay, all the other cells are the diploid cells. So this is going to be taken up by the fimbriae of the oviduct. It actually moves closer to the ovary, because remember, the ovary is not completely enclosed in peritoneum. It's not surrounded by the peritoneum forming the mesometrium. And so when the egg is released, it's released into the peritoneal cavity. So the peritoneal cavity is that area when you open up the abdominal cavity. The peritoneum is the membrane attached to the body wall, as well as around the intestinal organs. So that egg can go anywhere within the peritoneal cavity.
So
There was...
As soon as it exits that oval, the ovary?
As soon as it exits the ovary, it's within the peritoneal cavity. And it can land on the outside of the oviduct. It can land on the branches of the abdominal aorta. It can land on the aorta itself. The sperm are not restricted to the oviduct. They can pass up through the oviduct and out here and meet the egg out in the peritoneal cavity.
That's a strong guy.
Wow. There was an incident where a young woman became pregnant after a gunshot wound from, I know this is gross, but this is A&P, okay guys? Became pregnant after a gunshot wound that was fired by her ex-boyfriend after she had oral sex with her current boyfriend.
Wow.
You go through that again?
Mine deserves to get shot.
Okay. So she had oral sex where the sperm She swallowed, went to her digestive tract. Ex-boyfriend was jealous, came, shot her. Sperm exited the stomach from the gunshot wound, which wasn't life-threatening. Egg had been released from the ovary, but not taken up by the oviduct. Met the sperm in the peritoneal cavity.
The stomach acid didn't kill it, huh?
Apparently not.
Wow.
They had that
That's
done,
soon, I
and
guess.
done to make sure that he was the father then, I guess?
Yeah, you can do that nowadays.
Unless you
Yeah.
slept with them 3 days before that,
There you go.
or after.
Well, obviously,
So,
wasn't shot.
when that happens, an implantation occurs outside the uterus. It's called an ectopic pregnancy.
Yeah.
Most ectopic pregnancies, meaning out of place,
Or terminated.
take place, occur when the fertilized egg implants within the oviduct, within the uterine tube. In other words, let's say that the sperm are already waiting for the egg when it's ovulated here in the ovula, or rather in the infundibulum. Fertilize it in the infundibulum, or if it does get fertilized in the ampulla, which is the most normal place, takes too long as it moves through the oviduct. And it's reached the time of implantation while it's still within the oviduct. It will settle into the wall of the oviduct, but there's not, number one, there's not enough vasculature, and number two, the oviduct can't expand like the uterine wall can. And so it will rupture. And the woman will feel an extreme amount of pain and cramping. The scar tissue from that may or may not block that oviduct for subsequent fertilizations. She may or may not be left with just one oviduct. There was another case, interesting ectopic pregnancy, where, and I know we haven't done our blood supply, but the abdominal aorta, aorta is a large artery that carries blood out of the heart. The abdominal aorta comes down just slightly to the left of the vertebral column, and then just above the sacrum ends by dividing to form two large blood vessels. These run along the rim of the pelvis, and the internal iliac arteries go down, branch from that into the pelvis to give rise to the arteries to the uterus and the vagina and the bladder and so on. And the rest of the artery continues down into the thigh to provide blood to the lower extremity. So in this particular woman, they are actually underneath, behind the peritoneum. The peritoneum would be covering them. In this particular woman, she had gotten pregnant. She was pregnant. She had vague aches and pains. And ligaments stretch and get longer. You know, the round ligament has to get stretched out as the uterus rises up through into the pelvic cavity. And she had complained about this. She was going to a clinic. She didn't have the money for her own OBGYN. And they just passed it off as, well, that happens in pregnancy. She moved from Texas to New York and was going to a clinic in New York, and her doctor happened to be a first-year graduate who was just kind of an intern, seeing her as he moved from different parts of the, different types of practices in medicine. And he was surprised. She had the same complaints, and of course he didn't know any more than she did about some of that stuff. He was surprised. He came in, she was about 8 months pregnant, and they were wheeling her off for an emergency C-section, the chief OBGYN resident. And he didn't seem very happy with her intern doctor. And so the guy said, well, can I come along and watch? And he did. They did a full cesarean section, not the bikini one. And fetus the egg had been fertilized outside the oviduct. The embryo had implanted on the wall of the external iliac artery and moved down through the wall of the muscle tissue, gained access to the blood, which was plenty of blood, a lot more than the uterine artery, and the placenta developed. The amniotic clear membrane, almost clear membrane sac that embeds and folds the fetus, all of that developed outside the uterine wall. So if she had gone into labor and the membrane had ruptured, there was no birth canal for which that baby could pass through. So they opened up the amniotic sac and took the baby out, cut the umbilical cord off close to the baby, didn't have to cut the uterus at all. But then they were left, and the placenta is anywhere from 6 to 8 inch pancake-like structure, about that thick and so. If they took that off, they were going to have this huge gaping hole in the iliac artery. So what they did was just tied the umbilical cord off close to the placenta and left it in place. And without the fetus there to continually need a blood supply, it gradually involuted and became just a thick scab, if you will, on the surface of the iliac artery. But that could have torn and ruptured, you know, at the least the baby would have died and she could have lost one of her legs due to the lack of blood supply. So the intern doctor said it was all serendipitous. She got her baby. If they found this out earlier, they would have done a medical abortion, and you know, so it worked out for the best. But most of the time, ectopic pregnancies occur on sites where it's not viable for the developing embryo. So today we're going to look at fertilization and then get started.